My name is Ricardo Gonzalez, and today we're going to discuss everything you want to know about treatment options for benign prostate enlargement, or BPH. As men age, we develop urinary symptoms, and often that parallels the growth of our prostate because our prostates grow from puberty until we die. As prostates grow, they can choke the flow of urine, affecting how we empty, and also affects how our bladder stores urine. So the symptoms are frequency and urgency of urination, waking up at night, difficulty starting our stream of urination, and even urinary retention, where we get blocked up and a catheter has to get placed. Often men worry when they develop symptoms that they have cancer, but these symptoms are not related to a cancerous growth, but rather benign growth of the prostate. There are several options to treat the prostate, but I like to break them down into 4 simple categories. We'll go through those now. Let's call these treatment options buckets. The first treatment options lie in the bucket of behavioral modification and lifestyle changes. What is involved in having a prostate healthy lifestyle is the same that is keeping a heart healthy lifestyle. So a healthy diet and exercise is good for both your heart and your prostate. You want to limit red meat and dairy and have plenty of vegetables and eat fish. So that would be what you can do lifestyle-wise. You can also avoid bladder irritants. So caffeine, alcohol, spicy foods can irritate the bladder and cause some urinary frequencies. So if that's something that bothers you, that's another change you can do in terms of lifestyle. The second treatment option is what most people are on, which is medications. And there's 2 general categories of medications. There's medications that treat urinary symptoms, and there's medicines that shrink the prostate. Medicines that treat the symptoms are like tamsulosin or Flomax, and alfuzacin, which is uroxetrol. These are medicines that relax the prostate, help you empty the bladder better, but they don't actually shrink the prostate. There's also tadalafil, which is also known as Cialis, that can be taken daily. That can help relax the bladder muscle, and it helps urinary urgency more so than helping the flow. But in general, these medicines that I just mentioned treat symptoms rather than shrink the prostate. There are also the medicines that can help shrink the prostate, like finasteride and dutasteride. These medicines take months to work, but can actually reduce the volume enough that helps men avoid surgeries and avoid catheterizations due to urinary retention. These medicines take a while to work, and while we're waiting for them to work, we're evaluating other symptoms that can develop, because up to 12% of men can have sexual dysfunction from use of the medicines that shrink the prostate. The third bucket of treatments are called MIST procedures, or minimally invasive surgical therapies. These therapies can be done in the office and usually under local anesthesia. MIST therapies are best when the medicines are working, but you might not want to take a medicine. Once a medicine fails, sometimes the benefits of a MIST procedure might be too mild. MIST therapies include the prostatic urethral lift procedure, or Urolift, water vapor thermal therapy, which is Resume, iTind, which is an implantable temporary nitinol device that helps stretch the inside of the prostate without catheter use, and a new treatment called Optilume, which is an anterior commissurotomy of the prostate using a paclitaxel-coated balloon. These treatments, again, are not equivalent to surgery, but have the benefit of being able to be done in the office, and none of them are associated with worsening sexual function. The fourth bucket of treatment options are surgical therapies. Surgical therapies are done under anesthesia in the hospital usually. You either go home the same day or you stay one night and go home the following morning. There are no incisions for most of the surgeries that we do for benign prostate surgery. These treatment options include laser prostate surgeries like green light vaporization, laser enucleation like the HoLEP procedure. We have transurethral aquablation, which is a robotic water jet ablation that's done under image guidance. And then we have a robotic simple prostatectomy, which is done using a robot through the abdomen, working top down. Depending on the size of the prostate and your goals, we can help tailor the right treatment to each man. The benefit of surgery is it gives you the most durable response without having to take medicines. And the retreatment rates generally are about 1% per year, so that about 1 man out of every 10 men by 10 years may need a touch-up for recurrent prostate growth. As you can imagine, the 4 treatment options are not the same for every man. It really depends on what each man's goals are, what their problems are, what the prostate size and shape is. What our role as urologists is to work with you to find a treatment that best suits your prostate and alleviates your symptoms. Thanks for watching, and I hope this video answered your questions about everything you wanted to know about prostate enlargement.